Okay, why don't we go ahead and get started? My name is Tracy Hopper, and I'm the COO of Tria Health. In case you don't know, Tria Health is a chronic condition management company with a goal of improving healthcare outcomes and reducing total cost of care for people with chronic conditions. One of the things that makes Tria Health unique is that we utilize pharmacists to conduct one-on-one consultations with patients to improve their condition management. We believe that pharmacists are the best resource for this because chronic conditions are managed with medications and pharmacists are medication experts. What we also know is that each person's healthcare journey is unique. So having this individual consultation with a pharmacist allows our pharmacists to know why people aren't meeting their clinical goals of therapy. So what the pharmacist does is they're able to create these care plans, share it with their doctor and the member to improve overall healthcare outcomes. So many times this care plan will include remote monitoring devices, and the remote monitoring devices are great because they provide data to both Tria Health as well as to the member to improve overall health. And that's really what we're going to be talking about today. I think the thing that's important to know is that not all patients are created equal, and so not everyone needs a remote patient monitoring device, but those that do get it will really benefit from it. But making sure you get the right device to the right patient will ensure you're maximizing your plan value. So before we get started, a few housekeeping items. If everybody could put their phone on mute, that would be great, and ask questions through the chat feature in the Zoom. We'll get to the questions at the end. We actually had a few questions submitted prior to the webinar, so we'll make sure to get to those too. So now I'd like to turn it over to Annie Tribble, who's one of our clinical pharmacists. She has a Doctor of Pharmacy degree from the University of Missouri, Kansas City. She completed her residency with UMKC and Ball's Food with a focus on chronic condition management in the community setting. So she's a certified diabetes educator and has experience in both the retail setting as well as her experience here with pharmacy care at Tria Health. So she's a great asset to our team, and we're excited to have her present this information today. So I'll turn it over to Annie.
All right, thanks, Tracy. Hi, everyone. My name is Annie, and I am one of the clinical pharmacists here at Tria. Today, we are going to be covering the expanding role of telemedicine and how remote monitoring can be incorporated into your patient care with your patients. We will review the types of devices used in remote monitoring, the populations of people that will get the most benefit from remote monitoring, and the guidelines that we use to help identify who these patients are. And we're also going to discuss how this program can be integrated into healthcare. And finally, we'll discuss the clinical impacts of remote monitoring and the benefits for both the patient and the providers. The American Telemedicine Association defines telemedicine as the use of medical information exchanged from one site to another via electronic communication to improve a patient's clinical health status. Telemedicine continues to expand and is increasing access for patients to their care. Telemedicine can be done via video conference, telephone, and many other technologies. For patients to be able to communicate with their provider via telemedicine compared to in-person office visits saves time, money, and is a convenience becomes a major factor. Telemedicine was being used prior to the COVID-19 pandemic, but with the pandemic, patients became more wary of going to their provider's office, or they were unable to go to the office for a visit. COVID-19 has really pushed telemedicine forward and has been especially helpful and a vital part of chronic condition management. Patients and employees benefit from telemedicine as it gives patients the opportunity to manage chronic conditions effectively and avoid catastrophes In addition, employers can leverage telemedicine and provide a tool to their employees that will help improve their health. Remote monitoring is a method used to deliver healthcare, utilizing technology and devices to gather data from a patient that is outside a traditional healthcare setting, such as the doctor's office. Patients can be at home, work, or even on vacation, and data can be gathered. Remote monitoring is an efficient and very effective way for providers to be able to monitor patients' health conditions without requiring an in-person visit. Remote monitoring can also be done on the fly or in between patients that the provider is seeing in office. Remote monitoring can also be used for quick identification of poorly controlled health conditions and allow action to be taken without having to make an appointment to come into the office. There are many different types of remote monitoring devices. Each device can track data. However, accuracy of metrics can vary across all devices. The three most common devices that are used in a clinical setting are blood glucose monitors, blood pressure monitors, and scales for weight measurement. At Tria Health, we offer all three devices. There are many brands and types of each of these devices. And there are also wearable devices like Apple Watches, Garmin watches, Fitbits that can be used to track personal data, such as steps, exercise, or vital signs, including heart rate. Data can be shared with providers through Bluetooth or through cellular devices if a service provider can be reached. Bluetooth devices can be a little bit more difficult to set up and may require connections to be set up. And once devices need updating, it can require even more technical things going on. Cellular devices are a lot easier to use than Bluetooth devices because you just open the box and the device is ready to go as long as there is a service provider nearby. This is one of the reasons Tria chose to use a cellular-enabled device for our blood glucose and blood pressure monitoring programs. Not all patients are tech savvy, and this automatically overcomes that barrier of initial setup and use with the cellular device. It's important to note that while we do prefer the cellular meter, we do also work with other Bluetooth and cellular devices. So in other words, if a patient prefers their meter that they already have or a plan is set up with another meter or they're very comfortable with what they're currently using, and aren't ready to switch their technology, we have the technology to align with multiple different devices and support whatever decisions the patient wants to make. Sharing data is important for the provider and for the patient to improve our health outcomes. And the provider is able to monitor trends and improve medication and medication health literacy using these devices. And the data is used as a tool for condition and medication education, as well as therapy recommendations. Remote monitoring can be very beneficial to a variety of patient populations, such as those patients with a new or uncontrolled medical condition, those that have changes in their doses of medicine, patients that are experiencing condition or medication side effects like low blood sugars or low blood pressures. Remote monitoring is also a very useful tool when a patient has multiple medical conditions, or if they've made some lifestyle changes, such as changing their diet or exercise that may cause medication doses to then be too high. Remote monitoring is particularly helpful in patients that live far away from a provider's office, so maybe those more rural areas, and for those patients where communication is more difficult due to a language or disability. Now we will determine the patients that remote monitoring would be most appropriate for and how to figure out who they are. We must remember that not all patients are created equally. While some patients need to be monitoring their medical conditions with testing, it may not be appropriate for others. We want to provide monitors to those. We don't want to provide monitors to patients that don't need it. If they don't need it, that can create plan waste. And we also don't always have to be encouraging testing in certain patient populations, because if we are encouraging testing and it's unnecessary, that can create patient and testing fatigue. When determining if a blood pressure monitor is appropriate, we want to provide monitors to patients that are on 2 or more blood pressure medications or have uncontrolled blood pressure readings that are greater than 130/80, and or those patients that have high blood pressure in another chronic condition like chronic kidney disease or heart disease or diabetes. Remote monitoring blood pressure devices should not be used for diagnosis. However, they can be used to confirm a diagnosis and establish if blood pressure lowering medication doses are effective for their treatment. Remote monitoring may be best for patients that also have resistant hypertension, blood pressure readings above goal when they're at the provider's office, such as white coat syndrome. White coat syndrome is when a person is going to the doctor's office and they have increased nervousness or anxiety that causes their blood pressure to be elevated at the doctor's office. But on a typical, normal, everyday routine for them, their blood pressure is controlled. When it comes to diabetes, patients should be provided a blood glucose monitor as indicated by their circumstances, their preferences, and what their treatment plan is. Patients that are experiencing hypoglycemia, which is low blood glucose, and or taking insulin should be encouraged to use a blood glucose monitor or a continuous glucose monitor, a CGM device, when they're having their meals and using their insulin, as well as if they have symptoms of those low blood sugars. Lows can be dangerous in the moment, and that's why it's important for patients that have hypoglycemia unawareness or they're on medications that can cause hypoglycemia to be monitoring their blood glucose readings. If it is also inappropriate to use a remote monitoring device for blood sugars for patients that want to improve their diabetes with lifestyle changes and behavior changes, but are unaware of how food or exercise or their medication would affect their blood glucose throughout the day. So how does remote monitoring work to improve health literacy? First, providers will identify which condition they want to use remote monitoring for in their patients. Most programs are for diabetes, blood pressure, and weight management. They will next determine which patients in their population would be would have the most benefit from this service. After determining the appropriate patient, the patient will then start collecting data with the device they were provided. Once set up, the device will either submit data to the provider via cellular tower for those cellular enabled devices or be submitted through Bluetooth. Providers will then be able to analyze the data submitted, provide education, guidance, and therapy recommendations based on the readings and the results that they have received from the device. Patients and providers will then be able to review those readings together, whether it is in a virtual or telemedicine visit or an in-person visit, to continue to improve and understand what the readings mean and how they're affecting their health condition. At TRIA, we provide a blood glucose monitoring program that is now about 20 months old. The graph on the left shows patients at 1 month to 10 months using our iGlucose meter. We took the patient population and separated it into controlled and uncontrolled. We defined uncontrolled as an A1C that was greater than 8%, which is the standard set by the National Committee of Quality Assurance. With remote monitoring, education from the TRIA pharmacist on lifestyle and behavior modifications, plus medication counseling and recommendations, the percent of time patients' blood glucose was in range improved over that 10-month period. Thus, hemoglobin A1C averages were also lowered. This program has also allowed us to identify patients experiencing hypoglycemia and allows us to immediately contact our patients via text or reaching out to them from their pharmacist to ensure proper treatment and action was taken to avoid the lows or complications. We also provide a remote monitoring program for high blood pressure with our smart meters. This program is showing that with remote monitoring and the ability to outreach to patients at the time of readings and educate on proper technique, lifestyle modification, education, and medication counseling, readings decrease to a point that's clinically significant. While not all patients have had a decrease that was significant, patients that are enrolled in our program are not likely to see their blood pressure readings increase. Remote monitoring programs benefit patients in many different ways. Patients are more connected and have better access to their healthcare team. Patients' real-time health data can be seen by their provider without having to be present in the clinic. It allows medication doses and changes to be made in real time based off real-time data. Patients also spend less time at the doctor's office, which saves both time and money and reduces the likelihood of being exposed to other illnesses. Their time with their provider in the office becomes more qualitative and productive. Providers can spend time making more accurate medication adjustments and providing more education on that medical condition. Remote monitoring is driven by the patient, so we encourage them to take ownership of their own health. This also gives them information to learn and to discuss lifestyle and medication options for their health condition improvement. Patients are given more support and time spent on education about their medical condition when they are using remote monitoring. They're receiving more comprehensive care from their healthcare team. Patients aren't the only ones that benefit from remote monitoring. Remote monitoring programs allow providers to see the whole picture of a patient's health rather than just that small portion of time when they're in the doctor's office. This allows the provider to be a better doctor and be a better provider. It allows them to make dose adjustments based on a wider range of data and allows them to be able to provide more education, discuss other treatment options and ways to continue to improve their health. So providers are providing their patients with better quality care for their patients. We've talked about all the great benefits that can be received from remote monitoring devices, and here is an excellent example of what we have seen here at Tria Health. A Tria Health pharmacist identified a member via our iGlucose blood sugar meter help desk. This patient was taking oral medications and insulin for medication treatment of their diabetes. At the time, they had a well-controlled A1C and of less than 7%. And they were, however, having several occasions of hypoglycemia where their blood sugar was dropping less than 70. Having levels less than 70 can show that an A1C is great, but also indicates that diabetes is not well managed. Hypoglycemia is an event that can be very dangerous in the moment. It can lead to the patient passing out, having to go to an urgent care or hospital, or in the worst case scenario, it can lead to coma or death. The patient or the pharmacist helped identify when the patient's low blood sugars were occurring, which happened to be when they were taking their glipizide medication and when they were doing more strenuous activities and exercising. The pharmacist was able to provide the patient education on how to prevent these low blood sugars from happening and how to treat them through eating something before they were exercising and eating when they take their glipizide medication. And they also taught them about the rule of 15s, which is how we educate on treating our low blood glucose numbers. The pharmacist also recommended reducing the dose of glipizide and their Tresiba insulin to the patient and to their provider. At the follow-up with consultation, the patient was having fewer hypoglycemia events while still maintaining a well-controlled A1C. And by having this program in place and being able to have these interventions from the Tria pharmacist, a potential catastrophe was avoided. Success stories like these are just the types of success stories that our clinical pharmacists are seeing with the integration of this remote monitoring program and the success of it. So we've talked a lot about the great benefits of remote monitoring, along with the criteria that we should be using when trying to determine who is eligible. Before incorporating remote monitoring into your healthcare strategy, we recommend asking these questions to ensure that it is successful. What criteria are providers using to determine who receives a device? How is the provider monitoring and reacting to the readings and the data that they're getting from the device? And what types of reporting is available so that you can ensure the outcomes related, so that you can see the outcomes related to your investment in this type of product. It's been a pleasure to be able to present to you today over remote monitoring, but I will go ahead and turn it back over to Tracy for more questions.
Okay, so we had a couple of questions come in through the chat. The first one relates to the patient success story. And the question is, was the patient required to keep a diary to help identify events due to certain meds, lifestyle factors, etc.?
The patient wasn't required to keep a diary. We just typically during these help desk conversations and how the patients identify how we work to help identify when a low blood sugar happens is we go back through their day. Do you remember what you were doing this day? Did you eat breakfast? Did you exercise? What was your routine? And with the remote monitoring and it being so instantaneously, we're not having to ask the patient to look back over weeks and weeks of data. Usually it's what has happened in the last few days because we're getting alerted so quickly with the device that we have chosen.
Okay, great. And then the next question is, what are the benefits to remote monitoring of a glucose versus an automatic insulin pump?
Automatic insulin pumps we typically see used in our patients that are type 1 diabetics, and usually those automatic insulin pumps do have a data integration where they are connecting to a platform somewhere. The remote monitoring is useful when patients don't have an insulin pump or don't have access to something like that, and they are still able to have their blood sugar readings looked at on a consistent basis by a provider and sharing that data.
And Annie, isn't it true that only those that are insulin dependent are the ones that really benefit from the automatic insulin pump? And there are several uncontrolled people with diabetes that aren't insulin dependent. Is that a correct statement?
Exactly, yes.
Okay. Okay, so we had a couple of other questions that came in prior to the webinar. One is, what is the best way to encourage members to utilize remote monitoring devices? And I think here at TRIA Health, what we have found is that the individual consultation with the pharmacist really helps to understand what the barriers are to using the remote monitoring devices, as well as providing education on the benefits of using the device. So that consultation before the person gets the device really helps in their overall usage. In addition, then the remote monitoring devices allow the ability to send intelligent messaging. So if people aren't testing the way that they're supposed to, it can send messages of encouragement and so forth. So that's what we have found to be the best way. Another question was, how does employer education influence their plan participants to ask about remote monitoring? And I think what we have found from our experience is, from an employer perspective, we're able to provide marketing materials that they can use through their own channels to really promote the benefits of using a remote monitoring device. So what we do is we work with the employer to understand how they communicate their benefits and ways that we can help them with messaging to get that message out there. So hopefully that answers that question. We had another question, is this device vendor agnostic? Where is the patient data being tracked and stored? So at TRIA, we consider ourselves to be device agnostic. We do offer devices, the cellular device for both glucose monitoring and blood pressure monitoring, but we also have data integration through a data aggregator where we're able to integrate data from CGM devices, Dexcom CGM devices, and we're working on getting data integrated through LifeScan and Roche. So if we have the data integration set up, we're able to capture that data and use it. And the data is being stored in SmartRx, which is our system that we use to manage patients. Okay, any other questions? Another question that we had is, do we have any outcome data showing lower healthcare costs for those using remote monitoring devices? And so what we know is members that participate in our program, which includes both the pharmacist consultation and the remote monitoring devices, reduces healthcare costs for people with diabetes by $2,255 a year. And the average A1C reduction is 1.3 points. For members that move from uncontrolled hypertension to controlled hypertension, that savings is $9,656 a year per member. So there is pretty significant savings associated with being able to get people to control both their diabetes and hypertension. And then I think that's it. So if there aren't any other questions, we are recording the presentation and we will send it out to all participants after when we're done here. So thanks so much for participating. And if you have any questions, you can always reach out to us directly. Thanks so much.